If you're someone who is scared of needles and it may be holding you back from proceeding with fertility treatments, you'll want to listen to our guest today. 1 in 3 individuals around the world have a fear of needles. And today on Lunchtime Live at the Center, Dr. Kim Crone, who is our psychologist here at the Center, is with us to discuss some strategies around this to help you better manage the fear and stress of needles and injections. Dr. Crone, welcome back.
Thank you very much. Thanks for having me. Good to be
30% is not a small number.
30% is not a small number. And my guess is that the number is probably even higher and people just don't always admit it. And yeah, it impacts our patients' quality of life. It, causes them anxiety just about going through treatment. And it's something that's easily coped with as long as people put some time and effort into it.
Oh, well, that's good news to hear. What would be how would someone know if their fear is based on just nerves? I know I have nerves around it, fear, anxiety, or if it's a true phobia.
Yeah, so fear and anxiety are they kind of go hand in hand when it comes to needles. So a lot of people are nervous about it, and then they become fearful of it. And as long as they're continuing to function, they get their vaccines, they get their blood work, they do what they need to do with treatment here. It's just a fear. It's doesn't fit criteria of a phobia. It becomes a phobia when they're avoiding things because of it. So when that fear is intense, irrational, out of proportion with what the actual threat is, and that it changes their functioning. So they either avoid treatment, or they avoid something like a vaccine, or they have such distress related to it that it impacts their day-to-day functioning. They're not sleeping, they're not eating, they're having trouble focusing because they're so anxious about it.
Okay. So if we split this up between before appointments and during appointments, what are some techniques? So let's do some actionable strategies. What are some techniques a patient who is scared can use before an appointment?
Okay, so a lot of the things our patients can do are things that they want to do before the appointment, because a lot of them take practice, and that practice happens ahead of time, and then they can actually put them into place when they're getting ready for an appointment, getting ready for self-injections. Those things are mostly behavioral, so practicing things like relaxation strategies, autogenic muscle relaxation, diaphragmatic breathing, good deep rhythmic breaths that help people relax, self-hypnosis techniques, meditation, guided imagery. Guided imagery is a wonderful one because it's, kind of going someplace fun in your head, a very detailed kind of experience, maybe your favorite vacation or something like that. And it's just a nice way to escape. But it too takes practice because you want to get good at getting to that place in your head. All of those things are, things you can find online. You can find videos on YouTube to help you kind of work on those strategies. And the more you practice ahead of time, the better you'll be at coping with that anxiety in the here and now when you're actually going through the injection or the blood draw or whatever. So those behavioral strategies are a good place to start. There's also there's several cognitive strategies, but one I really like is one called cognitive diffusion. And it's one that you can use ahead of time by thinking about what your anxiety is. So say your anxiety is, I hate needles, I'm scared to do this, I don't want to do this. Not a totally irrational way of thinking. A lot of people hate needles, they hate to do this. But the more you perseverate and focus on that, the stronger that thought is going to end up being. The best way to handle thoughts like that is to try to create some distance between yourself and that thought. And you can do this through cognitive diffusion. And what that means is, make that thought kind of insignificant in your head. Do something like say it out loud to yourself in a cartoon voice, or sing it, or whisper it or say it really slow. Something that makes it just kind of silly and less significant can actually help you feel less connected to it. And all of a sudden, the more times you say it, it's like saying a funny word, the more times you say it, the sillier it sounds and the less connected you are to it. And you realize, okay, that's not so significant to me. So I like cognitive diffusion, and it is, again, something you can practice ahead of time. And then if you're sitting outside the blood draw room and you're nervous, you can do that for yourself. You can remember saying that in a squeaky cartoon voice and say, okay, it's not such a big deal thought. The last one, and the one I do with patients, and it's definitely one that you would want to start working on in advance, is something called systematic desensitization through exposure therapy. And that's kind of the gold standard in terms of working with needle fears and especially needle phobias. It's 90% successful when you're using it for needle phobias. And essentially what that entails is creating a hierarchy of what your anxieties are. So your anxieties about the needles. So say lower on the hierarchy might be looking at a picture of a needle, and then it might be holding a needle or holding a syringe, holding a syringe with medication in it, all the way up to thinking about giving yourself an injection. And we would make a list of that hierarchy and then work on relaxation strategies to help you get confident in being able to relax while you're being exposed to whatever that activity is. So we would start with a picture, and we would do a relaxation strategy to help you, decrease your anxiety when you're looking at a picture, and then do that all the way up to that point of maybe, the self-injection, where you learn to be confident and competent in your ability to relax during that time. Because all of these relaxation strategies, the reason they work is because they're incompatible with anxiety. And so as soon as you can kind of replace that anxiety with something that's more positive and incompatible with it, you're going to feel better.
How
all
long?
of these things are helpful.
Sorry about that.
Yeah.
How long beforehand, because it takes practice to do, how long do you recommend someone do this beforehand to get a feel for it?
So I usually think a good 2 or 3 weeks ahead of time, starting to practice at least twice a day with any of those techniques, even if it's something as simple as diaphragmatic breathing that everybody thinks they do, but we don't really do every day. Practicing it helps you not only become more confident in it, but it helps you get faster and more efficient at eliciting the relaxation response. And that's what you're trying to get to. You're trying to get to that point of being relaxed and heavy and less anxious, which then helps you cope better at times that used to elicit anxiety. But one thing you want to list, so fear is different. When you're feeling, you get anxious, your heart starts racing, your blood pressure goes up. That's fear. Someone who has a history of fainting in the presence of a needle or looking at blood or something like that, they actually don't want to relax. That's kind of the last thing they want to do, because you faint when your heart rate goes down and your blood pressure goes down. And a really quick change in heart rate and blood pressure often ends up resulting in somebody passing out or having a vasovagal response to whatever the stimuli is. So for those people, if you have a history of fainting, we actually encourage you to try something called, I never remember the name of this, it's ATT, applied tension training. And what that does is actually teach you ways to increase your heart rate and increase your blood pressure before you're exposed to that stimuli. And it's really just tensing different muscle groups to the point of feeling flushed, feeling like you're getting warm. The warmth is rising to your face. By doing that, you are increasing your blood pressure and your heart rate, and you're making it less likely that you're actually going to pass out. So if you've passed out before, you actually don't want to relax. You want to do more to kind of intensify your blood pressure to reduce your chances of passing out again.
That's good to know. So moving to during the appointment. So you're probably doing something different from before the relaxing and knowing how to relax before the appointment. But what are you doing during the appointment that might be different?
So during the appointment, you're going to use all those strategies you just practiced. So you're going to, if you're sitting and waiting for your appointment, or if you're trying to get ready to do a self-injection yourself, you're going to want to practice, or you want to put into place any of those relaxation strategies. So do some good deep breathing, go to some place fun in your head, whatever has worked for you. That's also when you're going to use more of the cognitive strategies. So these are more like reframes where you're thinking, okay, danger doesn't, or discomfort doesn't necessarily mean danger. I know this might hurt a little bit, but that doesn't mean it's dangerous. It's probably going to hurt less than I think it's going to. Try to keep that in perspective, remembering you've gone through this before. You've either done vaccines before or had blood draws before, and you've made it through, reminding yourself you've made it through that. And another one that I really like, and it's kind of growing in popularity, is a cognitive strategy called cognitive valuing, which is where you're really thinking about, okay, how much does this matter to me? If your goal is to have a baby, and the most important thing to you right now is to have a baby, then going through a little bit of discomfort to have that baby is worth it. So reminding yourself, doing that self-talk that you are saying to yourself, okay, this is totally worth it. This isn't fun. Nobody's going to tell you it's fun, but I can get through this because the value I place on the ultimate goal is way more important than the discomfort I'm going to feel for a few seconds. Or a few minutes, or a little longer with progesterone. It depends. But yeah, so those cognitive strategies, in addition to distraction. So listening to music, if you can bring a friend, have a friend be there for you as a distraction, as a cheerleader, anything that gets helps you get through that, and to prove yourself that you did it and you did great.
Okay, wonderful. So, and what you mentioned progesterone. So what recommendations do you have for a patient when they are self-administering versus something that happens during a procedure or an appointment in the office?
That's a good question. So self-administering is sometimes that step above for our patients, right? They've all gone through getting shots before or getting blood draws, and they're okay. It's that doing it to themselves that's tougher. For some people, it's helpful to ask somebody to help them with that. If they know of anybody who can help with them with at least the first few, just so they can get more comfortable with it, that's great. Either a partner, a spouse, a neighborhood nurse who is willing to help them. But a lot of our patients rather do it themselves. They don't like the anticipation of waiting for somebody else to do it, so they want to do it themselves. One thing I do encourage is to do whatever helps you. So whether it be ice, one of those buzzy contraptions that like vibrates and ices the spot at the same time and just helps take away some of that pain, numbs it a little bit. Emla cream is useful for people because it decreases the pain a little bit. Anything anesthetic that they can do. But also then my kind of stuff is more practicing the relaxation strategies, doing anything that can distract you at the time that you're actually giving the injection. You want to be able to focus to make sure you're mixing and measuring and doing all of that correctly. But at the moment that you're actually giving yourself the injection, anything that helps you be distracted, a funny movie on TV or listening to your favorite music can be helpful. Reminding yourself that you've got this. You've watched the videos, you know what you're doing, you've heard what your nurse has said, and you're ready. You can do this. So that confidence can really help.
Sounds like confidence is a big factor here.
Yeah, it is. And our patients often say it's not as bad as I thought it was going to be. They're so nervous about it, but then when they actually do it, it's easier than they think, and they get to be good at it.
Right. And when would someone see you as a professional versus something that they could do at home? When do you recommend them seeing you or seeing a professional about this?
Okay. Usually I say come see me or go to somebody who specializes in anxiety disorders. Oops, sorry, my light happens every time. If 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 you're avoiding treatment because of it.
Okay.
If you would do anything to try to go through a cycle, but the needles have you just so anxious that you're avoiding it and you're putting off treatment because of that, definitely reach out to somebody for help. The exposure therapy is very, very successful and doesn't take very long. And for a lot of people is a life changer. You can do some of that. I mean, there are really videos online for so many things. There are videos for exposure therapy that you can find on YouTube that I think are quite good. But it's a little bit more controlled when you meet with a therapist who's actually trained in doing that. Or if it's causing, like I said, so much distress that you're having difficulty functioning, and you're still committed to going through treatment, but working up to getting to that cycle time, you're just so anxious that it's really impacting your quality of life. It's worth talking about.
Okay.
Okay.
Do you have any suggestions? I mean, you mentioned YouTube. There's so much on YouTube. Do you have any favorites as far as home resources, scripts, meditations on this?
Yeah, so there's a book that I love, that's called, and of course I'm spacing on that now too. I wrote it down for myself so I didn't forget. Oh, it's called The Needle Phobia Handbook.
Okay.
And it's mostly about self-hypnosis. Some people find the author a little bit full of himself. I don't know. I didn't notice that, but it's got some really good techniques to help you get to a good mindset to do this and to get to the point where you can just tolerate it, because that's all we're really asking for, right, is to tolerate it. You don't have to enjoy it, you just have to get through it, and that book is really helpful. The other videos that are good, and again I wrote this down, there's one called Fear of Needles hypnosis session. It's on YouTube. It's by a man named Gary Madison. I've listened to it a few times. I like it a lot. I think he's good. I think his tone is good. And it helps you, again, it just facilitates getting to that point of the relaxation response to help you be able to do it on your own without those videos. Another one is called Overcome the Fear of Needles, and that's more of a guided meditation that I also think is good. And I've had patients listen to that and have found it helpful. So that book and those two videos are helpful. And then otherwise, those other strategies of like the EMLA and the Buzzy and the ICE, whatever it takes to get through it. And then reward yourself when it's done. That's a big deal when you get through your first, whatever it is, your appointment here or doing it yourself. You got to give yourself some credit, a pat on the back, and I don't know, a lollipop or whatever the lollipop is,
Right.
whatever your lollipop is.
Okay. Awesome. Thank you so much. Thank you for your time today. That was really helpful. I know it's going to help a lot of people out there.
Sure. Thanks for having me.
Yes, you're welcome. And thank you for watching today. And be sure to check out our website at yukonfertility.com for additional information, questions, if you'd like to reach us. And we will see you next time on Lunchtime Live at this center. Bye for now.